A very warm welcome to all of you. And if I say warm welcome, I mean it because I'm here in Vienna. Outside it's over 30 degrees, and I left my jacket in the car, and I'm here in short sleeves because it's really warm. So a warm welcome to all of you. As you know, or as you might know, we have decided to organize these Semmelweis talks every 2 months to keep the community connected between Semmelweis conferences and bigger events. It's a virtual talk, which has one big advantage and one big disadvantage. The advantage, the nice thing is, of course, is you don't have to travel. It's easy to participate. You're sitting in your air-conditioned room, listening. The bad thing is we can't have a beer together in the evening. So everything has pros and cons. Last time, as you might remember, on May 10th, we had the discussion about the importance of humor in hospital hygiene. I mean, we all know that it's not easy to motivate everybody to act correctly and do the right things in the daily practice of hospital hygiene and infection prevention. And so we are constantly thinking of positive motivation. And last time we had the focus on humor, and we had Didier Pité and Monika Julen. Monika Julen is the founder of the Red Nose Clown Doctor International. And we were reporting about a very nice initiative here in Vienna. The clowns, they have studied a Semmelweis song. They have dealt with the correct WHO hand hygiene procedure. And in over 20 hospitals, they had walking acts, and they were reminding and training and teaching everybody with a lot of humor. And we got a lot of extremely good feedback. So this is definitely something you should keep in mind. Use the clowns, the Red Noses Clown Doctors International. They are active in many, many countries. Maybe you have other organizations in your country, but this is a very nice methodology of delivering this topic to our patients, co-workers, colleagues, relatives, everybody. Today we will focus on another positive approach, how to motivate people to keep the hand hygiene up. In this second Semmelweis talk, we would like to promote again the idea of the Hand Hygiene Excellence Award. And our first speaker will be Thomas-Jörg Hennig, the global project manager of the Hospital Hygiene Excellence Award. He's already here. He will give an introduction on the history and the scope and the whereabouts of the Hospital Hand Hygiene Excellence Award. After that, we are happy and proud to have the two winners of the last European Hospital Hygiene Excellence Award with us. This is Elke Schindler from the hospital in Villach and Martina Močenić from Pula in Croatia. And I had personally the honor and the pleasure to be in Geneva at the ICPIC when both of them were on stage and received their award and had the hug and the handshake and the photos with Professor Pité. And that was a very emotional moment. And I think it's worthwhile to again reflect the entire story, how they got there, what were the problems, how could they make it successful? Because as you know, it's a long process. It's not something that you just get easily. It's something that you really have to focus on and that you really have to want. But again, it's a positive approach of motivating people towards hand hygiene. After the three presentations, we will have room for discussion. The three presenters will stay on stage for us with some more time. And of course, we have prepared a couple of questions, but feel free to put any question into the chat. The chat will come to me, will be delivered to me, and I will then post the question to either the three of them or one of the three. Yeah, well, with this, I think everything administrationally is set. The scope is set. And I would like to introduce Thomas first. As I said, Thomas is the global project manager of Hospital Hygiene Excellence Awards. He's a trained chemist, which I personally find very nice because I'm a chemist myself. He started with B.Braun in 1993. In parallel, he was heavily involved with the Esculap Academy. He's trainer at the WH Cooperating Center on Patient Safety. He has implemented local hand rub manufacturing in countries like India, like Thailand, like Brazil. He has developed an app to monitor the 5 moments of hand hygiene, and many more, just to mention some of his numerous achievements. And Thomas, we are very eager to listen to you and learn more about all the whereabouts of the Hand Hygiene Excellence Award. Thomas, please.
Thank you so much for this very warm welcome, and welcome everybody to this Semmelweis Talks, which I really appreciate having the honor to being invited. Okay, so it's about the Hand Hygiene Excellence Award. I would like to walk you through what's it about. What is your prize? So basically it's a trophy made of glass and a lot of honor and reputation, being one of the top hospitals having implemented the hand hygiene, the WHO Global Hand Hygiene Improvement Program. And normally we invite 2 persons of a hospital which has been announced as a winner to regional or global IPC Congress like ICPIC to share their success stories and to provide them a platform to share their experience, how you go through this process. If you want to apply, are you ready? You can identify your status if you use the self-assessment framework, hand hygiene self-assessment framework from the WHO. And if you're an advanced hospital and you have hand hygiene leadership, at least 12 points in each of the categories, at least 1, then you are ready to apply, and you should have a 5 years history, or even better, if you have more years, to document hand hygiene compliance improved, infection rates decreased, and the surrogate marker is hand rub consumption decreased. But if you're not ready to apply, it doesn't matter. You can be ready if you use the WHO tools. You can prepare yourself, or you can ask us to support you, or even better if you ask the winners, because they are the role models for the region and it's their obligation to support you. So to apply, you go to the Hand Hygiene Excellence Award homepage, hhea.info. Then you complete the self-assessment submission form, which is basically the WHO hand hygiene self-assessment framework plus additional questions. An expert panel reviews your application and decides on the finalists. The finalists, they will be visited. The experts evaluate winners, and finally the winners, they are invited to the Congress. And the key elements is that you successfully applied the WHO multimodal strategy. You show decreasing healthcare-associated infection rates, at least 3 years of hand hygiene sustainability program, and strong leadership. You will learn from the following hospitals what means strong leadership. So from the compliance view, all expert panel members, they're flying economy class and they work free of charge. And this is to ensure an independent decision on the winners. And the questionnaires does not ask what kind of hand rub is used in the hospital. So it's totally independent, this prize, from any brand. It's just the efforts and the results the hospital achieved. And because of COVID-19, we couldn't do online real visits. They were audited online, but that worked also very, very well. So how did it start? It started in June 2009 when Professor Pitet, I think I don't have to explain who this guy is, agreed to become chairman of the award. And we were thinking, what kind of award do we offer? Do we do a gold, silver, and bronze based on a self-assessment frame only? We thought that is, people can start cheating to give themselves a gold medal. Then, okay, if we add audits, it's like accreditation. Yeah, accreditation is always painful. Yeah, if you have gone through accreditation, you get a certificate and that's it. But we thought the right way is adding a competitive element and announcing the award based on a self-assessment and visiting of the finalists to check if it's really true what they put in the forms. And from June 2009, February 2010, we were ready, and application period ended in October. So very, very fast. And the first hospitals, they had to apply an open questionnaire, answer questions, and describe all their efforts, what they did, the action plan in each of the 5 elements of the multimodal strategy. That was very complicated to review. We had to employ a nurse, infection control professional, to go through all these applications, compile the data, summarize it, and compare the hospitals, then to decide how to become a winner. In the meantime, the application form has been simplified, make it more user-friendly. It's an Excel spreadsheet, and after 4 generations of questionnaires, now we have the final spreadsheet you fill in, and you get a dashboard, an overview, which is very helpful for the experts to decide upon the winner. So what we see is hand hygiene compliance rates. We see number of observations. Of course, if the compliance rate is stable, you need less observations. Decrease of infection rates, increase of hand rub consumption. And here we have a perfect example. What is next? We can go to the operating theater and switch from antimicrobial soap to alcohol-based hand rub. Faster, more skin-friendly, higher effective. So that is the basis for the experts to decide upon the finalists, and after visiting the finalists, they decide upon the winners. And now we run this award 2010 until 2022, and it engaged many IPC professionals. We shared expertise, we identified role models and encouraged their leadership. And it's about being part of a global movement. What does it mean? We even get poster presentations or publications. And here's an example from Romania. Their key elements about their hand hygiene improvement program over 5 years was accreditation by JCI and the Hand Hygiene Excellence Award. Result, increasing hand hygiene compliance to 90%, which is very good, and a very high alcohol-based hand rub consumption rates. So if you have a look globally, we have more than 400 winners. In Asia, we started in 2010, 2012, we went to Europe, 2014 to LATAM. MENA and Sub-Saharan Africa, we announced, but due to COVID, it's on hold. Everybody can apply who is a hospital having inpatients in line with the WHO criteria for a hospital. And we see we have 189 applications in Asia, 27 winners. This is the latest figure. In Latin America, we have started 4 years later. We have only 209 winners, but 230 applications. So why is there a big gap? The gap is sometimes the hospitals, they are so good. It's like in the World Championship final. You're in the final, and to become a winner or not decides a penalty shooting. And we didn't want to do this. So if there are 4 or 5 winners so close together in one round, they all get awarded, but then only one person is invited to the Congress to maintain the budget. And then we have more than 2 winners. This is totally up to the experts. They decide independently on the finalists. And in Latin America, we started late, and due to COVID, we can only start visiting the finalists this summer. In Latin America, it's probably winter. And for that reason, we have far less winners in Latin America than in Asia. So, conclusion, we have a Hand Hygiene Excellence Award. It's the hand hygiene program which is the driver to improvement. It contributes to harmonization of hand hygiene practices all over the globe. It provides innovative promotional activities for improving hand hygiene practices. So we are always, when I have the honor to join one of the visits of the finalists, a very impressive demonstration of innovative promotion materials. I think you will learn later. And it's about role models for other hospitals and countries. So don't be shy to ask your colleagues. They are happy and it's their obligation because they won the prize to support you. And we create regional and national networks. And finally, it's a global movement to prevent infections and to maintain or improve healthcare quality services and health outcomes. So that's from my side. Thank you for inviting, and I'm ready to reply to questions whenever you like.
Thank you very much, Thomas. That was a very comprehensive overview about what was built and about this fantastic idea of motivating people to achieve this Hand Hygiene Excellence Award. In general, we would want to have the questions at the end when we're in the discussion. There is only one question I would like to place immediately. The question is, why do you have gray spots on the landscape? What about the Middle East? What about North America?
Yeah, North America is quite challenging because we need experts for visiting the hospitals, and they have JCI accreditation and a total different healthcare system than we are used to in Europe or other countries around the globe. They have single bedrooms, and nurses are not allowed to enter single bedrooms to monitor patient treatment and observing hand hygiene opportunities. This is illegal according to US law, and it takes us the basis for data collection. We are missing this. And in the Near East, Arabic countries, it's very, very difficult to travel. Visa is an issue, and in some regions is war, so we can't send the experts to war areas to audit hospitals.
Yeah,
that is the reason behind. Theoretically, they could apply, but if we can't visit, we can not guarantee,
of course,
that they become a winner.
Thank you very much for clarifying, and thank you very much for setting the stage for the two lectures that we are going to hear in a moment. I would like to mention something that we on purpose did not mention at the beginning when we ramped up the whole thing. We are very motivated to keep these Semmelweis talks going, and at the end I will give an outlook to the next Semmelweis talks and the speakers and the keynote lectures of the next Semmelweis talks. But we are very thankful to Schülke. Schülke is our sponsor, and together with Schülke we have built this little platform to present these informations. The next story will go to Villach. Many of you will know Elke Schindler. She is currently the medical director of the hospital in Villach. She started as an anesthesiologist and intensive care doctor in the hospital Villach. Then she became member of the hygiene team. Then she became member and then head of the quality management group and leader of the antibiotic stewardship program. And finally, she was appointed director of the hospital. And now the question goes to you, Elke. How did you become successful, and what does it mean for a hospital to achieve this Hand Hygiene Excellence Award? Elke, please.
Thank you, Bernhard. I hope you can hear me because I have no picture of you. So, you see it?
Okay. Fantastic. Thank you very much.
Fine. Thank you. Thank you for the warm welcome, Bernhard, and thank you for the opportunity to make this presentation because associated with the winning the prize, we have to be ambassador of hand hygiene. So we made the promise to DDPT. And so it's a nice opportunity to make this presentation to other guys who want to apply perhaps for this award. Just before, a little data about our hospital. Villach Regional Hospital is one of 5 province hospitals in Carinthia under the holding corporation of Carbeck. We have more than 660 beds and 1,800 employees. And I think you can imagine it's not so easy to help them all them on the way for the right hand hygiene in the right time. Our task is to provide medical and nursing care for the area of the region of Upper Carinthia. Yes, and how it all started. In October 2018, I met Bernhard Kühnenburg. He held election on our Hand Hygiene Day, and he gave us the kick to apply for the Hand Hygiene Excellence Award. So we are looked for the evidence for this apply, and I want to send ahead that we are still working with the Standards of Joint Commission International. Our first accreditation was in 2003, and so we are going very familiar with the international patient safety goals. And you see the number 5 is to reduce the risk of healthcare associated infection. And so we had a lot of data to show what we are doing to reach the goal. We checked what we are doing, and we had a lot of employee training because Villach Regional Hospital is a certified institution of further education. We have trainings in person and online, and we also provide mandatory hygiene training. So Thomas was talking about strong leadership, and we have an on-the-job training by our hygiene team. And with proud I can say we organize one of the largest Austrian hospital hygiene conferences. Then you see our most popular tool in action, the hand hygiene scanner. I can tell you our staff love it. Make the self-control, so the scanner is in every ward for more than a month, and then everyone can use it and can make his self-control if you do the right hand hygiene or not. On the other side, we celebrate the International Hand Hygiene Day on the 5th of May many years ago with a lot of activities. So you can see it on there with a quiz, and we created patterns, and we have really good cooperation with the Red Noses Clown Doctors. I can see, I show you a little bit later. Yes, and we create our own hand hygiene movie. It's on the house channel, and for the patient and for the staff. And last but not least, our highlight is the conference in hospital hygiene. It's one of the largest in Austria. In 2020 we had 13 days. You can see the pictures there. You can imagine that's not the actual pictures, because we had a very comprehensive hygiene concept, but I want you to show what is going on this conference. Yeah, and there is a lot of challenges because we need to arouse interest for the topic in our employees. And we must permanent process of building awareness with always new activities. So our hand hygiene team is running out the hospital with giveaways, and I told you before our cooperation with the red noses clown doctors, and you can see it on the right side. Even during the pandemic, the red-nosed clown doctors are visiting our hospital and coming for our little patients. Yeah, then we are looking for our data to complete the self-assessment submission form. So we are a member of the campaign Clean Hands from Charité Berlin, and are very familiar with measuring the consumption of hand disinfection. And in opposite to the United States, we are allowed to observe correct hand hygiene. Other further activities, we are very proud that we could implement an antibiotic stewardship with a team of medical doctors and pharmacists. They present annually the bacterial-resistant data in every ward. They present annually the antibiotics usage, and we are take care on the point prevalence study from CDC, and you can see we make a presentation of our hospital-acquired infection, and we are under the average of the other Austrian hospitals. They are take care on this study. Yes, and then we received if the expert will come, and if we are one of the finalists, and then they are here in June. They visit our hospital. You see the DPT and Dr. Widmer, and they are running around the hospital and speaking with our staff, and this was very, very nice moment. And in the end, you can see our CEO was here, the politician from our city was here, and the DPT said goodbye with the words, "To be a finalist is to be in the Champions League." Then it was time to wait of the discussion and to evaluate the winner until the liberating email is coming. It was a great pleasure. Yes, and then because of that, we are traveled to the ECPIC in Geneva, and we can hold our presentation and to receive the award. It was a very great day for our team. It was very nice to meet the colleagues from Pula and to get this award. And I say thank you for your attention. Save the date. The next conference will be held in October this year, the 5th and 6th October. And it's for me, it's very fine that I can tell you that the next speaker, Martina, will come to visit us and to share their experience with the award. Thank you.
Thank you very much, Elke. This is a very nice success story, especially we have heard it before from Thomas, it's not something that we do fast. It's a long process. It needs years and years of showing a reduction in infection rate and increase in hand hygiene. And then you apply for the award, and then you get the official audit, and then you're awarded. So it's really a long process, and it's more like running a marathon and not a sprint. And I would like to again congratulate Elke and Herwig and her entire team to this very nice achievement.
Thank you very much.
The second success story, of course, is Martina Močenić from Pula, and she is a teaching nurse at the University of Pula since recently. She is, of course, by training an intensive care nurse and at the university at the clinic in Pula, but she did also educations in Zagreb and Rijeka. And 2015, she took over the head nurse from being a head nurse in the intensive care unit to becoming the hospital hygienist with her team. And we are very, very excited to listen to you, Martina, how you managed in Pula to get this fantastic achievement of winning the Hospital Hygiene Award.
Firstly, I want to say hello to you, to organization of this talk, Semmelweis Foundation. And it's a real honor to be with you today. And thank you once more for the invitation. So in Pula, it's really nice to work now because we have a new general hospital. So we are the only hospital in Eastern region. Croatia is developed in some regions. So we are in the Eastern region, and we are here on our coast. Istria is peninsula. So it's Adriatic Sea, and the tourist season is really started hard this year. So I will try to share our experience with the Hand Hygiene Excellence Award. A few information about General Hospital Pula. General Hospital Pula is the central and the largest Eastern health institution. Pula General Hospital is situated in the center of the city of Pula, and today employs more than 1,306 employees, about 277 medical doctors and 571 nurses. More than 208,000 inhabitants are living in Eastern region, but that number is double, triple during touristic season. So it is really important to have all implementation of good patient care and the patient safely in our hospital. Annually, we hospitalize about 15,000 patients per year, and there is more than 5,000 surgical procedures. And we have in the hospital 20 different departments. How we decide to apply for Hand Hygiene Excellence Award. So firstly, hand hygiene guidelines was implemented in our hospital for the first time before 19th. So the main reason for implementation of all guidelines and our work was patient safety and reduction of hospital care associated infection, especially cross-infection. So we start with the system change then and implement of global hand hygiene guidelines in our hospital. Then we educate all staff about importance of hand hygiene and how to quality do the procedure of hand washing and hand rubbing. And what is the main reason why we apply was for support of our product manager for hand hygiene, Mr. Dražen Obradović from B.Braun. So he talked with me and he suggests us that now is the time to apply for Hand Hygiene Excellence Award. He's working in all Croatia, in all hospital, and he tell me it's time that you can apply for this. You are ready for that. And at this moment, we were with a lot of question tag under our heads, and we started to see where we are, to measure our results, to analyze it, and then we decided to apply when we have seen that our results are really good at that moment. We are working for 3 years in one program of prevention of multi-resistant bacteria spreading in General Hospital Pula and the long-term health facility in Eastern region. We are sponsored by our local health and our administration in region of Istria. So we are doing education for all medical and unmedical staff in long-term health facilities, and we have got great results of this, and I will talk about this program on event which will be in October in Villach. The journey and the roadblocks on the way, so it was a difficult time for all of us, for all the world, and especially for our region, because we are on the border with Italy. As you know, the COVID starts after China in Italy, and that was not good for us because all our inhabitants who are living near border usually work in Italy, and there was daily changing and movement, so the numbers of COVID patients was really, really high. So we had the problems with the hand hygiene and wearing gloves, because you can remember on the start, in the beginning of the guidelines, there was some suggestion to wear 2 or 3 pair of gloves, and hand hygiene was not good at that time. And on this way, there were a lack of alcohol antiseptic on the marketplace. So this was a really difficult time for all hospitals, but we don't have that problem, because our leader, our supporter get us enough it for that moment. And what was next was a new hospital location. So in this picture you can see our old hospital. It was a Navy hospital in the beginning, but after it was a general, and all during this time we were changing the location, so we were moving from one part of the city to the another, and it was really a journey for us, and it was hard in some part of this, because we needed to plan and to buy all the equipments, to make new posters and everything that we needed for the hand hygiene at the same time, and the fight with the COVID pandemic. How to motivate staff and stakeholders. So most important thing, that everybody needs to be involved. Everybody needs to know what we are doing now and why we are doing this. So it's important that we are in a team and that we work always together. So our hospital management was with us all the time, and they support us with our idea, especially our medical director Irena Hrstić and our head nurse Irina Pucic. I work in infection control team with my colleagues, Jasenka Lončarić, she's infection control nurse, and microbiologist Dr. Lorena Lazarić-Stefanović. We're working together for a full time at work, and this is the real thing that you need if you want to win. And especially you need to have focus on the clear goal. Every employees that who are involved need to see the goal with the same eyes, and we all need to be on the same way. So it is important that we are all together going in the same way. How the Hand Hygiene Excellence Award triggers change? We were so happy at the moment when we were in the ICPIC with our award, and it obliged us to continue to improve to ourselves and to our patients, because our patients deserve everything that they need to have. So we need to be better, and we need to invent in prevention all the time. To invest more and more in education of all staff, it is important. We have training and education in our hospital, and we are trying to do this once or twice a year, because we can't stop talking about hand hygiene. Hand hygiene is a global problem, and when everybody thinks that they know everything and that procedure is great, someday when they try to do hand rubbing, and then they see it in the box, they see that is not so good. And we need to invest in technical equipment. So we are preparing Nozo X is a nice way to number observation for the hand hygiene. So we will not do it anymore with a paper and with a pen and checking it. It will be some informatic results for us. What to do when you apply for the Hand Hygiene Excellence Award? Firstly, you need to have educated team with a strong wish to win. You need to be objective, sincere, real, innovative, and involve all employees. Do not, when applying for the Hand Hygiene Excellence Award, so do not give false information. Everything that you write in assessment, when auditor comes to your hospital, they will check everything. So it is not good for you, neither for your reputation, and neither for auditors. And don't apply if you don't have highly motivated team. So this thing you need to have. And on this picture, you can see us from General Hospital Pula and our colleagues from Hospital Villach in Austria. And I always want to share good feelings with somebody. So it was great for us to meet Professor Schindler and her team in Villach. And on this last slide, I sending you greetings from General Hospital Pula, from management, our hospital, for all my infection control team, and for all employees that are working today. I need just to translate this last slide of a video. Thank you all employees of General Hospital Pula who are working and responsible are working on their positions. This award is a big award for all of our teamwork, and clean hands save lives. Thank you for your attention.
Thank you very much, Martina. And again, congratulations to you and your entire team. And also thank you for this very nice greeting with the music and the video from Pula. And probably many people, or most of the people know this area, Istria, Pula, Medulin. This is a fantastic area to be, and even more with the hospital with this fantastic award. Before we come to the discussion, there are two things. First of all, I would like to read a comment to Thomas from Will Sawyer. He says, for Thomas, I've been an infection prevention advocate, reducing preventable infectious disease, HHEAs included, for over 25 years. Created Henry, the Hand Hygiene Foundation and Hand Hygiene Behavior Change Program in 2000, hoping to spread the word, not to germs, to the world. So I would like to include North America in your initiative. Thank you, William P. Sawyer. And we will submit to you, Thomas, the email address of Will Sawyer. So maybe we get the program at least into the United States. Very, very good. The second thing that I wanted to say is that our team has prepared the Hand Hygiene Excellence Award movie, the short movie that you wanted to show at the beginning. And before we start the discussions, we will have the movie for a minute.
It is an award to identify the best hospitals and to provide a platform to learn from the best.
You have a scoring system whereby you can score yourself. How good is the institution to promote hand hygiene? And if your score is good enough, you can apply as a candidate for the Hand Hygiene Excellence Award.
At each of our audit visits, we only spend half a day at the institution. We use the WHO self-assessment framework.
To be awarded, you need to have at least 3, if not 5 years of sustained improvement of hand hygiene and decrease in infection rates.
More and more hospitals are joining in the program, promoting hand hygiene as a way of life.
So, thank you very much to the technical team. We finally got the movie, and I think it is important because it's a very important message again to everybody about what it is and what it should achieve. We still have the chance to have the 3 of the speakers here, and I would like to start with a question to Elke. I mean, Elke, you presented this as if it was a very easy walk along the park, and you did it, and there it was. How difficult was it to get everybody excited and involved, including the hospital management, and what were the big roadblocks that you hit?
Yes, it was shown that it was an easygoing way, but you know, and everybody of us knows it wasn't an easygoing way. On the other side, I told you that we are very familiar with working with the standards of Joint Commission International since 2003, and so we know how to get the people, the staff in our program, because there are a lot of standards we must show to the surveyor how we do it. So we have learned to do it, but I think it was the best way was the way on your Semmelweis Talk on the 10th of May. It's the best is with you.
Thank you. But it takes more than just an idea of myself to you. It takes much more, and we all know that. We appreciate that. But yes, getting people involved, and you had experience from your Joint Commission.
Yes, and so we had that was Martina told us you need a very good team, a team who is going out through the hospital and bring the stuff together and show it. And it's very good to show and to live for this, yeah, and not to say you must do it, and you must show how is the right way. And it's the same like a comedian long time before say how I shall educate my children if they do all in the same way like me. And I think that's what we are doing.
These are very wise words, and I think involvement of the people and the positive example is probably really the way to go. Question to Thomas. I mean, over 400 hospitals have applied globally. Only a fraction of those have won the award. Why did the others fail? What is statistically? What is the biggest problems that you meet? Why does it not work with all the other hospitals?
I don't accept these questions. The other hospitals are also very good at a very high level, but it's like the World Championship. So the hospitals who are finalists, they are in the final of the World Championship, and there will be only one winner. Normally we have in 2 years, we have 2 winners in every region. So we would like to motivate these hospitals who have not won to reapply. And what we experience is even finalists, if they haven't won, they get a feedback from the experts where to improve. They know exactly their improvement areas, and next round they reapply. And all these hospitals who have been finalists followed the recommendations of the experts, implemented improved the areas which were pointed out, and they became winners. And the discussion among the expert panel is always the same. They are already very good. They have become finalists last round. Now they implemented everything which we recommended. They deserve the prize and they get it. And by the way, they have to be better than all the others. And what we see is an increase, a massive increase in the level of implementation around the globe. So the first applicants, they could get away, become winner with a scoring of 380 points out of 500 possible. And what we see now, the scoring is much higher, but this is not the only criteria. It's how they implemented the campaign, and even innovation is observed and included in the criteria. If they are very innovative, it's the whole concept what is honored by the experts.
Thank you, and I do agree this is the right answer to my provocative question. Those 400 hospitals are already above the pack, and the winners are the top of the top. That's absolutely well taken. But is there a kind of statistical information about the roadblocks? Is it more convincing the elderly colleagues? Is it more convincing the financial director? What are typically the barriers that you have to break through and to overcome to get successful?
I can give you one example. It's from a hospital which have been announced as finalists. And the infection control physician, he never get good contact with the CEO. And our team in this country, they went to the CEO and they told him, hey, you're already finalist, and what's it about? It's leadership. And if you don't lead this campaign, if we don't see you when Professor Pitte or the auditors are coming, this gives a bad impression. And then he looked deeply into the program, what his team developed over the years, how much effort they put in. And they won the prize because they are very good, the university hospital, top level. And now the infection prevention doctor and the CEO, they are best friends. They won an award. They know each other, what is it about. And in a nutshell, I would say, the highest challenge for all the applicants is to get a budget and to get the buy-in and support from the CEO. If this is given, their projects run much smoother.
Thank you very much. I like this example. This is a beautiful example. Martina, what was your biggest problem? Was it the CEO and the budget, or what was it in your case?
I think that we didn't have any problem in that way. Maybe we had a problem with our staff. Why with our staff? Why with our employees? Because firstly, we started to teach them to wash their hands with a soap and with the water or antimicrobial lotion. So, and then in some moment we changed this procedure. So it's the best way to do hand hygiene is to hand rub and to use alcohol antiseptic. So I think we had a problem with behavior change. So we were working a lot of this, and now I think that we are on the good way to implement in every point of care. So point of care is the point where healthcare employers, a patient, and some procedure are together in the same in the one point. So this is the time when you or me, when we need to do our hand hygiene, and so this we can do only if we use alcohol antiseptic and if we'll do hand rubbing. So washing is not option in this way. So I think that we have problem with this. Our hospital manager is great, and we didn't have problems in this way. And always we are always in different departments in our hospital. So we are talking with our healthcare workers, and we're trying to implement new ideas from them. And so we didn't have problems in that way.
Thank you very much. If I summarize what the three of you have said, to all the listeners who plan or who have the idea to go for the Hand Hygiene Excellence Award, get your CEO behind you, get a budget, and then start with behavioral change. That's it.
Yes.
Good. So
one point about budget, please. At the very beginning, the Hand Hygiene Excellence Award was founded in Asia, and we thought it's not fair if we have low-income countries and very high-income countries like Singapore. They have easier access to the budget. At the end, after visiting the finalists, the experts said it would not be fair to announce two prizes, because the low-income countries, it would look like a second-degree prize, so not at the same level. And they are equal. It's not only about budget. If you have no budget, you can compensate with creativity, motivation, team spirit. And for that reason, that was one of the key learnings we had. The budget can be small, but sometimes it is really budget. So it is not an exclusion criteria. Yeah.
Thank you very much for this extremely important comment. But I would like to take it further to the next question. I mean, you want to see 3 to 5 years of constant improvement before you even apply. Then you get the award, and then is it over? How can you assure sustainability? Is there a second generation award or something like this planned? How do you assure that this thing is sustainable?
You're speaking about campaign fatigue. So you do campaigning over years, you win the award, and now you're done. That's not the case. So for the hospitals here in Villach and Pula, now the work begins, because they have to motivate other hospitals, teach them how to become an expert center in hand hygiene, and maybe a finalist or even a winner of the Hand Hygiene Excellence Award. And what we see is winning the award really encourages the winners to maintain on their path, to do more efforts, and to maintain the very high level they have. And hand hygiene never stops. Improvement is always possible. And that is one of the reasons why also the WHO, when they started the Global Patient Safety Challenge in 2005, it was prolonged until 2010, 2015, and hand hygiene campaigns are still ongoing in 2022. Every year we celebrate May 5th, not to forget, not to relax, comfort zone, and phase out improving hand hygiene. There's always space for improvement.
That is true, and that was not exactly the answer to the question how I meant the question. I mean, of course, Elke and Martina, they will be your ambassadors and they will motivate other hospitals. But what is happening in their own hospital? Is it declining now that the award is over and it's achieved? Elke, how will you sustain the level that you have achieved when there is no more goal to get and no more prize to win?
So no, also we can't stop. Yes, this improvement we must improve. So hand hygiene is an important part in our daily life. The winning of the prize made us very proud, but that's it. Yes, it's in the entry of the hospital and it's standing there, but we must going on. But sometimes it doesn't work. So I can tell you, last Christmas, our kitchen was baking some cookies in form of hands for all the patients and stuff. And I can tell you need very good teeth to eat them. So sometimes it doesn't work, but we get to improve. And I think Martina will say the same. Yes, you can never stop it. Yes, if you're on this level and you can stop it. And so we promised to Didier that we are an ambassador in hand hygiene, and that's what we're doing. So you can see on the 5th of May this year, we have been in the Ministry of Health and so going on, and can talk in other hospitals what we are doing for this. And I hope a lot of people will apply for this trophy and for this award.
Martina, would you agree?
Yes, I will agree with Professor Schindler. I think that this award obliged us to be better. And when we came from ICPIC with the award, our medical director asked me, is not now over? No, it's not over. It's a new beginning. So we need to be number one, we need to give our patient maximum that we can. So we need to invest in prevention, and we need to talk about hand hygiene. Like I have said before, hand hygiene is a global problem because everything starts and begins in our hands, on the hands of healthcare workers. So there is no end with talking about hand hygiene, and when we talk about prevention of hospital-acquired infection. So I think it's a new beginning for us. We need to be more and more on the number one position of hand hygiene.
Well, Thomas, this is easy for you because you have two highly dedicated and motivated people here who really fight for the hygiene in their hospitals, and they will never let it go as long as they are there. I can feel that. But from your organization, do you plan re-inspection after a couple of years? Is there an upgrade prize that you could win to incentive further efforts in this direction?
We are currently reviewing this because we started in 2010. It's 12 years established in Asia. And we have ideas like an alumni or something like this. Or you are free to reapply after this second period. So you cannot reapply the next round. You're blocked. But after 3 years, you can. If you're still good, you can win. If others are better, you're not winning. But it's up to you.
No, I think this is going exactly in the right direction because you want to make the whole thing sustainable. You don't want to lose what you have to achieve, and I think this is a good idea. One of the things that hit me is that when the Semmelweis Foundation gave a talk back then 4 years, it was the first time that Elke heard of the Hand Hygiene Excellence Award, and she's a professional hospital hygienist back at this time in a big community hospital. What can we do all together? You, Thomas, the two ladies, myself, all the listeners, what can we do to spread this fantastic initiative and increase the number 400 to 4,000?
Yeah, we have the best options is social media. You take pictures of the prize, you spread it, and you know your colleagues, you know congresses, and every ICPIC there's a winning session, there's a plenary lectures about the Hand Hygiene Excellence Award. So those people who go to congresses, they learn about. It's on our homepage. We promote the message during May 5th, and we measure this. So we track the number of visits from our social media posts to the Hand Hygiene Excellence Award website. And it's one of the successful websites, micro websites we run in B.Braun. So from electronic posting, I think we are good. What I would like to improve is word of mouth. And yeah, you do it, you do newspapers in Romania, in example, the Hand Hygiene Excellence Award winners, they were on the 8 o'clock evening news because they were so proud on TV. That is fantastic. Maybe we can do one publication. That's also an option to increase the noise. But basically, I think infection control experts who work in hand hygiene, they know about, and I especially thank you from the Semmelweis Foundation to give us a platform to promote the award.
Of course, and we're very glad to have you there and to have Elke and Martina, and it's a fantastic success story. But when you have achieved something, you have to think about the next step. I mean, that's the same, like you have started with hand hygiene, the 5 moments of hand hygiene, and now you're taking the next step towards hospital hygiene. Hand hygiene are the basic, and the hospital hygiene is now the next thing that you're going to promote.
Yeah, and we are working on this, believe me.
We know that, but our topic is how do we get this out of this community? Politicians have to know it, patients have to know it, the population has to know it, relatives have to know it, and this is still in a very early phase. And I think we have to jointly together, we have to think of ways how to transport this fantastic award into the public. Elke, what could you do more in Villach, or did you already play the entire piano of communication?
So first of all, we will present our award on our conference in October, and there are more than 400 participants. So I think it's spread it over, and otherwise I'm invited to hold a lecture in Bucharest about the award, so I hope it's going on.
Martina, what about you?
I can talk about Hand Hygiene Excellence Award that we won in 2021 on our Croatian Association for Infection Control Nurses. So I shared our experience with all my colleagues from all hospitals in Croatia country. And I have heard about Hand Hygiene Excellence Award when I was starting doing this job before 7 years. Because I know that one Croatian hospital has applied for European Hand Hygiene Award, but they didn't receive it. So it was another thing that motivated me so hard to catch this award. So I can only agree with Professor Hennig, because only social media today at this moment can help us to promote Hand Hygiene Excellence Award. So information can be spread everywhere, in every country and in every continent. So I think this is the way that we can promote it.
Thank you very much. I will quickly go to the chat room because I've got a couple of interesting questions. Will Sawyer asks the two ladies, have you tried to have the hospital infection rate in the local newspapers to have competition, or the award to have competition between the hospitals? Did you have a publication in your hospital newspapers about winning the award?
Yes, sure. We have it on the homepage, on the intranet, and we had local newspapers with our city, the mayor of our city of Villach, had it in the newspaper, and we have been in radio on OE3 in the high noon news for the young people. So we were very proud that whole Austria heard on the radio that we are the winner of the prize.
So Will, that was done. And Martina?
So the same in our country, we were in the local newspaper, we were in the medical public journal of Pula Croatia, so everybody could read about our award, and everything is written and the video is posted on our website of General Hospital Pula. So we were talking a lot about it, and everywhere I go, I always talk about this award. So it's.
So we have two extremely motivated managers in the hospitals here, and they have really tried everything, is including being in the local newspapers and creating this competition. There is a question to Martina, two questions actually. First of all, how was this monitoring system that you mentioned? How was that tolerated by the staff, and where did you get it from?
This new monitoring system is not yet in our hospital. We are in the phase of preparation, so it will be from B.Braun company. It's called NozoX, so maybe Thomas can explain more about this product because maybe I don't have full information on this for now. So we will start with it in October if everything will be okay.
The question is it a Big Brother is watching product and people will be very hesitant to use it because at the end they are fired because they didn't disinfect their hands
First, we will start in intensive care units in the place that we can monitor and that we can easily implement everything new, because always the person or healthcare workers who are working in intensive care units are friendly to something new, and they want to implement everything that we suggest them. So I expect that everything will be great, and we can
you see the problem. You see the problem that theoretically it could be a very fierce control of your employees. So it's a Big Brother thematic.
They are controlled all the time because we are always there. So when they see us, we are a real reminder for them to do hand hygiene. So I think that there will be no problem with this.
Thomas, maybe you can comment on this control factor of this system.
With all automatic systems, no matter from which company, people are afraid Big Brother is watching you. Yeah. And to overcome this, the system records alcohol-based hand rub consumption. It records a timestamp, and depending on the level of implementation the hospital wants, they can categorize by healthcare worker group. So you can say this is for nurses, for intensive care nurses, for doctors, or for auxiliary staff, and that's it.
Can you back it down to the personal level?
This is illegal because of data protection.
Mm-hmm.
It is done in Arabian countries, where there's no data protection. They like to do, and they do it, and the staff has no problems with this. I think in Europe, people are more sensitive to data protection, and what we want to achieve is motivation of the staff, not demotivation. If you control too strictly, if you screw too strong, then you receive the opposite effect.
Yeah,
people start cheating. Yeah, they pump hand rub and not using it. They pump it in the glass and pouring it into the washing basin to show they use a lot, which is ridiculous. Yeah? We don't want this. We want real data. And for this, we need the trust of the people who get observed.
Absolutely.
And it's for their own to become better.
Yeah. So you need, if you implement it, you need the necessary communication to explain exactly this to the people using it.
Yeah. So
Well,
all about hand hygiene implementation programs is motivation. It's not punishing.
Yeah.
That is the reason why the award was created. And if you motivate your team, they do it on their own. They take the ownership and they observe each other and they, hey, you forgot, yeah. And then it's positive reinforcement. And that is the ultimate goal of the Hand Hygiene Excellence Award, to support implementing a safety culture, using all the tools and all the implementation steps over a long period of time. And the culture you don't achieve by just implementing an automatic monitoring system for hand rub consumption. This is a long process and everybody is involved. And that is exactly what these hospitals here are doing, haven't done, and doing in future. And that is what we like. It's a win-win situation. Patient wins, hospital wins, less infection, less occupancy, length of stay is reduced, AMR is reducing. So fantastic.
Absolutely. It's a win-win-win-win-win-win situation. Thank you very much for this comment. I think that was a good response to the question of one of our listeners. How about people? How do they react when they are controlled? I would like
may
to...
I make a comment?
Oh, of course.
Yeah, so I will say the same like Thomas, because we have seen it with our hand hygiene scanner. We had, if we implement it, we had a really great discussion if we must control the usage of this, or we can give it to the ward and do it by self-control. And I think the best way was to do this in self-control. So it is really, really a good accepted tool, and everybody of the staff loves it. And everybody is running for the scanner, so they matched themselves in the ward who can take this for 1 month and who is the best. So I think it was the right way, not to control with the hygiene group. Otherwise, we did do it in self-control.
Thank you for the hint, because the scanner also scans personal data, and you might have a similar problem by Big Brother ideas, and people, especially in Europe, people are very sensitive to this topic, and that's a good point. I would like to read one comment of Will Sawyer again. He says, friendly competition between hospitals and communities can help. Many healthcare workers, docs, nurses and support staff are competitive people and like to win. Particularly the C-suite like to be winners. So this is a comment from our friend in the United States. So it seems that they are carefully watching what is happening here in Middle Europe, in Central Eastern Europe, and what the WHO has built. We are coming to the end of our time. I would like to ask each of you for one final statement, and then I will wrap up the whole thing, and then we're done for today. Elke, please.
Oh, only one sentence: hand hygiene must going on, improve.
Very good. Martina.
Clean hands save lives, so be careful and clean your hands and invest in prevention.
Absolutely correct. Thomas.
Yeah, I would say safety culture implementation by hand hygiene as a door opener. It doesn't stop at hand hygiene. We have more things to do, but it's the right way to do. And now hand hygiene becomes a way of life. That's it. Even outside the hospital.
Thank you very much for these final words. I thought this was a very important discussion, and also the presentations, because as mentioned at the beginning, it's a positive way of inspiring and motivating people towards more hand hygiene and towards cleaner hospitals. I would like to make a couple of closing comments, more organizationally and then towards the future. There is our feedback link in the chat. And we would be very, very happy if some of you could give us feedback on the time, on the structure, on the way how we set up these Semmelweis talks. That would be very helpful because we want to continue doing this in cooperation with our sponsor Schülke. And the next Semmelweis talk will be on September 20th. And our keynote speaker will be Petra Gastmeier. We will announce that on time. So 2 weeks ago, 2 weeks before the show, 1 week before the talk, we will send out information. That is September 20th. And the next after that in early November will be Professor Voss. And we will also send out sufficiently early information that people can register for the talk. Having said this, I would like to thank you all for your attendance, for staying with us, for listening. We had a constant number of participants throughout the entire session, which is very motivating. Thank you for that. I would like to say a warm goodbye to everybody. It became even warmer in here. Now it's not 30, it's 35. And I think it's time to get some fresh air, open the windows, get some ice cream. Thanks a lot to everybody and see you again next time.
Thank you very much. Bye-bye, everybody.
Thank you. Bye.
Thank you. Thank you. Bye.